divide the neck, anterior and posterior triangle, and anterior triangle can further subdivided into this submental, submandibular, carotid, and vascular, muscular triangle. Now I want to tell about the vascular arrangement of the neck. Regarding the vascular arrangement, we can divide the neck into three compartments, that is the superficial, intermediate, and deep. This is superficial, intermediate, deep compartment. Superficial compartment lies below the platysma and superficial layer of deep subbrachial fascia. It contains the anterior jugular vein, external jugular vein, and communicating veins. Tips for this first compartment: during the thyroid surgery, to dissect in midline between the medial borders of step muscles, stay between two anterior jugular veins. And anterior jugular veins may be more than two or even single in number. That is called the median cervical vein, and should be preserving the anterior jugular vein to avoid the postoperative flap edema. Vessels of the intermediate compartment, that is the common carotid, internal carotid, external carotid arteries, and branches of the thyrocervical trunk. Here are the pictures. The external carotid is important carotid artery. It originates from the carotid triangle at the level of upper border of the thyroid cartilage. Initially, it found in anterior and medial to the internal carotid artery, and it takes a gentle aspiring course then and goes to the anterior and then lateral position related to the internal carotid. These are, it lies lateral to the styloid process and the connecting muscles. 12 nerve passes lateral hypoglossal nerve, that is, and glossopharyngeal nerve passes medial to external carotid arteries. These are the branches of the external carotid arteries, of which the superior thyroid artery is important for us. This is the it is the first branch of the external carotid arteries, has a critical relationship with the superior laryngeal nerve, lingual artery, facial artery, branches of the thyrocervical trunk, and also the inferior thyroid artery. It is the branch of thyrocervical trunk. It is important that in its course, before supplying the thyroid and the parathyroid gland in level 6, it has an intimate relationship with the recurrent laryngeal nerve. That is, the recurrent laryngeal nerve may pass the superficial to internal inferior thyroid artery, may pass deep to the internal artery, and may between the branches of the internal inferior thyroid artery. Internal carotid, no branch, and internal jugular vein is important. This is the it is the continuation of the jugular valve, and in its level 2, it crossed on its lateral surface in descending order by the accessory nerve, spinal accessory nerve, occipital artery, digastric muscle. This is tributaries of internal jugular vein, and vessels of the deep compartment are vessels of vertebrovesical systems. Now the important nerves of the neck, this is the spinal accessory nerve, external branch of superior laryngeal nerve, recurrent nerve, hypoglossal, and so. I just touch the spinal accessory nerve, which is very important for us, head neck surgeon. Spinal accessory nerve descends from the jugular foramen near the medial wall of the internal jugular vein, medial wall, and deep and posterior to the plane of styloid process. The superior branch of it is important. The superior branch of occipital artery intimately related with the spinal accessory nerve. Okay. Then the identification. One of the important thing is that at this level, spinal accessory nerve associate with the anterior medial surface of sternocleidomastoid muscle in its upper third with anatomical variation. This is the anatomical variation, not penetrating, sometimes partially penetrating or completely penetrating. And the nerve enters the level 5 by crossing the posterior border of the sternocleidomastoid about 1 centimeter of Erb's point. Now the identification point of spinal accessory nerve during surgery. In 4 regions we can identify. At first entry point of sternocleidomastoid muscle along the anterior border of the sternocleidomastoid muscle, where the nerve is accompanied by the branch of occipital artery. Exit point, about the 1 centimeter of Erb's point. The Erb's point in the point where the great auricular nerve emerges along the posterior border of sternocleidomastoid muscle. Also in the roof of the posterior triangle and in the lower neck, anterior edge of the trapezius, about the 2 to 5 centimeters superior to the clavicle. Here I have tips that careful elevation of the posterior skin flap is crucial to prevent the spinal accessory nerve, and at its entry point to sternocleidomastoid muscle, it is accompanied by the occipital artery. Can cause the bleeding during the dissection at this level, and injudicious use of diathermy to stop bleeding may jeopardize the spinal accessory nerve. Then this is the external branch of superior laryngeal nerve. We have another session where Professor Ashikur Rahman Bhuya will discuss this nerve and relations. So that's all. Thank you everybody for patient hearing. Thank you. Thank you.